Hi, everyone. Welcome to another episode of an interview with an expert. Today, I am so thrilled to introduce Tieya Qualls. Tieya is a pelvic floor and orthopedics physical therapist who holds a pelvic rehabilitation practitioner specialty certification through Herman Wallace. She's the owner of Quality Touch Physical Therapy and Wellness, a mobile practice serving the clients in the comfort of their home within the Washington, D.C. metro area. We're super grateful to Tieya for offering to give us a glimpse into her amazing journey and provide some valuable education on stress urinary incontinence today. Tieya, thanks so much for joining me.
Thank you for having me. I appreciate the invite.
Absolutely, absolutely. Any chance that I can get to work with you and collab with you, I'm all about it.
Yes, me too, me too, me too. I love it.
Great. So first question, so what inspired you to be a physical therapist and even beyond that, a pelvic health physical
Yeah.
therapist?
Well, it's funny you said that. I just did a post on this today or the last couple of days about what inspired me. And actually, I knew I wanted to be a physical therapist since I was in high school. And basically, I started volunteering, or I did like I guess you call it a little volunteer thing at a hospital. And it was at the rehab unit. And so I was able to see the physical therapist in action. And I just had never had that experience before. I didn't even know what a physical therapist was. And so when I saw that was a profession, I was like, oh, you get to help people. They can learn how to walk better and all those different amazing things that we take for granted. And I just, that was the initial spark that got me interested. And then, fast forward to PT school and beyond into the working world, while I was in school, we had a lecture from a couple of ladies who own their own practice that specialized in pelvic floor conditions. And with them had coming and lecturing to us and telling us all the things about pelvic floor. At that time, it was called women's health, as a matter of fact.
Right.
And so they were just telling us all about women's health. And I always had an interest in helping women, improving the quality of life for women. So I was like, this is right up my alley. And then I basically, from that point forward, continued to get a little bit more information and a little bit more experience, learning how to become a pelvic floor therapist, taking Connect courses and working at places that had that particular specialty, and just led me in this direction.
I love it. I love
Yeah.
it. And it's so amazing that you knew the path that you wanted to take. You had your goal, you had your big why, like I want to help empower women and help
Yeah.
them through this journey. And then you took your journey like almost like all the way. Like you went ahead and got a specialty certification
Hmm.
in the field. Just everything you do is super impressive. And you also stepped out and started your own practice, which is
Hmm.
what I'd really like to ask you about next.
Sure.
So, can you kind of share with us a little bit about your practice, where you're located, and who you
Mhm.
treat?
Yes, you already kind of mentioned the name, but I'll say it again. It's called Quality Touch Physical Therapy and Wellness, and it's a mobile practice. And for those that don't really know what that means, basically, I take the clinic to you. So I go to the homes or even just a private space of the clients to treat them in the comfort of their own space and be able to provide whatever service they need. So I don't just do pelvic floor conditions, I treat the whole body, but I have that specialty in pelvic floor. And so basically, I decided that I started off doing this, trying to do this as a side gig, and the universe had other plans for me. And so I got thrust into it all of a sudden as my main gig. And so that's pretty much what got me going. And so I just really enjoy being able to meet people where they are, literally and figuratively, and being able to see their natural environment, seeing them in their own home can be very helpful to get an idea of what their challenges may be, what types of things they may have around the house to work with as we work together, and then seeing them be able to utilize the the clinical part into their everyday life is very helpful. So yeah, so I just love it.
Absolutely. And a huge resource for new moms, too, because something that I run into with patients, because I've also been doing mobile practice for a while,
Hmm.
is that when you come to them, they don't have to, find a babysitter for
Yes,
the kids or get
that's so
everyone
true.
packed up into the car or,
Mhm.
come and sit in a waiting room. Like you are
Yep.
coming directly to them. It fits into their schedule. So
Yes.
it really is patient first, quality
Hmm.
care, and it
Hmm.
is kind of that quality touch,
Yes,
if I
yes,
do
yes.
say so.
Yes, indeed. I love it.
Cool. So today we wanted to highlight a common pelvic health dysfunction and kind of put a spotlight on stress urinary incontinence.
Mhm.
So, in your own words, Tieya, how would you explain stress urinary incontinence?
Basically, what I try to use, the verbiage I try to use with my patients to make it really understandable is that there's pressure that's placed on your bladder. For a lot of people, it may start during childbirth, for instance. There's a lot of pressure in the abdomen that's pushing down on the bladder. And unfortunately, the musculature and connective tissues from below aren't able to provide that support that's needed to keep the urethra closed. The urethra is the tube where we urinate from. So because of that excessive pressure and the inability to like close it off, then you get that leakage when you cough, laugh, sneeze, lift, or do anything where there's excessive force. So that's how I try to explain it to my patients so they get the concept a little bit easier.
Yeah, yeah, and that makes a ton of sense.
Mm-hmm.
So you were talking about this pressure pushing on the bladder. So where would that pressure come from? I know you mentioned a few activities,
Mm-hmm.
but if we were talking about like the cause of stress urinary incontinence, like what
Um,
causes it?
Yes, definitely. Basically, for instance, let's take a pregnant patient, for example, just to narrow it down a little bit. When the mother is growing that baby, the abdomen is increasing in size because the uterus is increasing in size. And so the bladder is underneath the uterus. And so that poor little bladder is getting squashed a little bit, as well as in many other organs. And so that excessive pressure begins to play on the I'll say typical function of the bladder and the musculature that is usually good enough without that extra pressure and weight. So it could be the increased abdominal pressure from the baby growing. Sometimes it could be things like if your audience has heard of diastasis, where there's a separation in the middle of the abdomen. That system is impaired because when there's a little weakness in the center, that means that the pressure system is off a little bit. So other systems are going to take the brunt, so to speak. So that could be a cause of it. What else? There's so many different causes of stress incontinence, but a lot, the all in all is just excessive force that's placed on that bladder.
Yeah, it makes sense.
Yeah,
So
it makes sense.
who would be at risk for experiencing stress urinary incontinence? I know you stated women that are
Mm-hmm.
pregnant, that excess pressure being placed on the bladder as the baby's
Mm-hmm.
growing, and then postpartum as well if they have,
Mm-hmm.
as you mentioned,
Mm-hmm.
diastasis. So there's some
Yes.
weakness within the core system, that pressure
Mm-hmm.
management system. But I mean,
Yes.
what about other populations? Men, is this something we need to
Yes,
consider
definitely.
before pregnancy as well?
Yes, definitely. Other people can also experience stress incontinence. It could come from the way we breathe. If your breathing mechanics are off, you know how people are heavy weightlifters and they may end up doing that weightlifting and they hold their breath and they don't realize that that breath holding is doing the same thing, even though it's an invisible force. It's pushing down. So weightlifters, if they're not able to understand how to breathe properly, as well as not being able to support from below with the pelvic floor musculature. People who, let's see, all of a sudden they lift something very heavy in their home, for instance, and the same mechanics, the weakness in the core, the weakness in the hips, the inability for the pelvic floor muscles to be able to counter force. What else? Men can also have stress incontinence. I don't typically find that that's very common on my end. I don't know if you have other experience, but I haven't heard of a lot of my males telling me they have stress incontinence or even, seeing that in the clinic. So I would say majority of my patients are female.
Yeah, same for me
Mm-hmm.
because we're both kind of in the same niche. So I don't
Mm-hmm.
really even work with men at all, or I
Oh,
haven't
okay.
for years. So yeah, so
Yeah.
prenatal and postpartum is kind of where I call home. So working with
Mm-hmm.
women and empowering them throughout their journey. But I loved the examples that you're giving. And actually, another population I find this a lot with is runners, because with
Oh,
running, you
yes.
have a lot of
Yeah.
impact. Yeah, go
Cool.
ahead, Ty. Do you want to talk about that?
Yes. No, yeah, you just reminded me. Yes, that impact when you do high impact activities. So you got people who are high level athletes, or even just weekend warriors, or people that do a lot of jumping. So you got the gymnasts, the people who, like you said, running, people who, for whatever reason in their career, have to do a lot of landing on their feet heavily. So you might have people who are military. They may have had that kind of experience as well. So a high level impact, a lot of high level impact without proper training of their core and their pelvic floor together. That combination can tend to lead to things like stress incontinence.
Yeah, and I love the way that you were talking about kind of the systems approach, because for the
Mm-hmm.
longest time when we were talking about stress urinary incontinence, in the past, it was, it's the pelvic floor's fault. It's always the pelvic floor's fault. We
Yes.
just need to strengthen the pelvic floor. But really our scope should be much broader than that, because the
Yes.
body is working together as a holistic entity. So it's this systems approach. And I love that you're talking about this
Mm-hmm.
dysfunction, not as a pelvic floor dysfunction, but as a system dysfunction.
Yes. Yeah. And you just made me think of something else too. I think when we talk about that system, it's people will sometimes come in and say, oh, I've been doing a whole bunch of Kegels and I thought that would help. And that might be a part of the solution. However, if you are doing Kegels, that means you're shortening your muscles. And if the muscles are already tightened for some reason, which you wouldn't necessarily know that until a physical therapist such as ourselves does that check of the muscles. But if those muscles are already shortened and you go in and Kegel, then a lot of times those muscles can't do their job anymore properly. They don't have any more length. So what I like to incorporate, which I'm probably getting ahead of you a little bit, but what I like to incorporate is lengthening as in conjunction with strengthening, so that you have that the efficiency of the muscle being a little bit better.
Absolutely. Yeah, I remember when I was in my public health training, and something that completely blew my mind was when I realized that a lot of incontinence is actually due to a tight or contracted pelvic floor, and
Yes.
not, I mean, you can have incontinence with a weak pelvic floor, but most of the
Yes.
cases are actually with a tight and constricted and
Yep.
short pelvic floor.
That's so true. And you know what I found too is that sometimes after just doing some lengthening during the session, like I usually would check beforehand because we're always assessing. So
Hmm.
they'll come in and tell me what's going on for that day, and then I'll check beforehand, ask them to contract for me so I can see what the muscles are doing, and then I'll do some release work. And before we even get into any strengthening, you could feel and they can tell that the muscle is contracting even better. So just that lengthening can be the key for a lot of people, just to improve that one aspect of what's going on with the incontinence.
Absolutely. And something else I wanted to touch on too is that in our society, incontinence has been normalized so
Yes.
much. Like, even when you
Mm-hmm.
walk into the grocery store, there's an entire aisle of adult diapers. And
Yes.
something that, an obstacle that we're kind of up against in public health is just letting individuals know that, hey, once you reach a certain age, that doesn't mean that you have to have urinary leakage. Once
Yes.
you have a baby, that doesn't mean that you have to have urinary leakage. It doesn't matter what has happened in your story or how old you are, urine leakage is never normal, no matter
Yes.
how common it is.
That's so true. I love that terminology because I was speaking with another colleague about that. Things can be typical, but that doesn't mean or make them normal. We don't want to normalize things that aren't. So I love that you're saying that you're using that.
Yeah, yeah. I love that you're a fellow taboo breaker.
Yes, I try to be. I'm a
Yeah.
renegade.
Love it. So, this actually, now I'm answering my own questions, because the next question I was going to ask is stress urinary incontinence postpartum normal? I guess we
Hmm.
could say that all together. The answer is no.
No, 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 not at all. So if you're experiencing stress incontinence, or really any incontinence, but for this purpose, stress incontinence, definitely see a pelvic therapist. You would probably have seen your gynecologist or your OB, and they may have given you some advice. And what depend on that device, it may not always involve pelvic floor therapy, unfortunately. So if you're questioning that, definitely seek out pelvic floor, a physical therapist in your area, because the first thing is to have them feel the muscles and see how they work, see how they're coordinated, and then from there they can help you with your road to recovery, essentially.
Absolutely. Yeah, I
Mhm.
agree. So I'd love to hear a story, because we love stories in this group. But
Mhm.
if you wouldn't mind sharing with us a story of a patient or client whom you worked with who was experiencing stress urinary incontinence, and kind of what that team relationship and that rehab process looked like.
Yes, definitely. What comes to mind for me is thinking about some of my pregnant patients, but one in particular who, again, I had this person during pregnancy and then transitioned to the postpartum period. And so during pregnancy, I explained to her that, you may experience distress incontinence, and we're going to do these types of interventions that involve some of the things I already talked about, which is lengthening of the tight muscles, strengthening of the appropriate muscles. So that's core and that's hips, as well as pelvic floor, in preparation for delivery. And then I also like to encourage the moms, or just any patient, but particularly my moms, let them know that this may happen a little bit more as your belly is growing. So, we're going to work through it as best as we can. We may not get to 100% totally leakage free before birth, but we definitely, I'm hopeful that we will definitely see that on the opposite side. Then she came in after delivery, after she had her postpartum check, and, we assessed everything. And based on what I found, what we already talked about, core weakness, she had a little bit of diastasis, she had hip weakness in the glutes and the abductors in particular. And then, of course, there was pelvic floor laxity, pelvic floor weakness. And so basically, we went through that program that involved, lengthening of any tight structures in the abdomen, the lengthening of the hip musculature. I like to make sure that they have appropriate hip flexibility, because those attachment points are so pivotal for pelvic floor function. Also, again, to any tension spots in the pelvic floor, we address that. And then we also, like I said, in conjunction with all that, we bridged it together with that strengthening component for all of those muscles, and worked on the diastasis, worked on the back muscles. So it was a holistic approach. And from there, we could progressively see how her stress incontinence symptoms improved as we worked together.
I love that. And something that you kind of touched on is the importance of having a pelvic health PT on your team and in your corner, even before labor and delivery, like during
Yeah.
that pregnancy process, because I fully believe that pregnancy is this beautiful period where you can get into the best shape of your life and really prepare for labor and delivery. And the work that you put in while you're pregnant, I mean, that is going to lead to great results in your rehab postpartum, quicker rehabs,
Mm-hmm.
and you'll already have a lot of strategies that you can incorporate into your healing process postpartum, such as breathing strategies, like you
Yes.
mentioned, to decrease that pressure,
Mm-hmm.
and postural strategies as well. And I love that, again, talked about that beautiful, holistic, full body
Mm-hmm.
approach to pelvic health.
Yes, indeed. Yes, indeed.
Nice. So when you mentioned some of the internal work that you do with some of your clients, and the one that you just told us a story about, so you were talking about trigger point releases. So do you
Mm-hmm.
use any fun tools, or any ladies that are listening to this and they're like, "Oh, internal work? Like, what is that? Is it scary? Should
Yes.
we be scared about
Okay. I'm glad you asked, because yes, I take it for granted that everyone knows what I mean, and that they
this?"
will not
Me
be
too.
concerned, because we do this all the time. So I do apologize. But yes, basically for the pelvic floor patient, and not all pelvic floor therapists do internal pelvic floor work of the vaginal or rectal canal, but I do encourage that that's done in these predicaments. But anyway, when I feel for any type of tightness, what we're doing is basically we're taking one digit typically, and we're inserting it into the vagina, and we're basically going to feel the muscles, just palpate or touch the muscles to see what the quality of the muscle feels like. We're going to also look at the strength of that muscle, the power, the endurance, and coordination, because we want to make sure that that muscle knows how to contract as well as lengthen. And so we look at all of those elements. And so when we're doing that, it's very gentle. I always tell my patients that if anything is uncomfortable, to let me know. We want to make sure that they know that they're in control of everything, and we can stop the vaginal portion at any point. And then based on what we find, we'll kind of develop that treatment approach based on what we find. And, I always let them know that they, it's going to be progressive. It's going to be a journey, so that they feel comfortable in knowing that it may not be like you're cured instantly, and some people may, but that's not typically the course, but that it'll be a process. And most people are really, fine with that, and they understand it, and they're on board, and we do very well together.
Nice. I love how
Mm-hmm.
you're saying, during the whole assessment process, the patient is controlled the entire
Yes.
time. They are the boss. Um,
Yep.
and, as public health PTs, we're constantly asking for consent. We're
Yes.
constantly explaining what's going to happen next. We're on the same team with our patients, and it really is a team approach. And that's one of
Yes,
my
indeed.
favorite aspects of being a physical therapist and a pelvic health PT, just being on
Yes.
a team with a patient and working towards their goals. So
Yes,
I
indeed.
love that explanation.
Yes, and it's I love that you use that terminology team, because I use the same terminology and I tell my patients we are a team, we're working together. So it just as much as my role is important, their role is also important. So we're going to always give our patients, or me in particular, I'm going to always give my patients something to take home. So they're going to have to do their homework, because if you only come into the sessions, or for me, if you only work when I'm there at your home, then you likely won't see the outcomes you're looking for, either as much or at all sometimes, if you're just waiting for that visit. So I often tell them, if you do your part and I do my part, I think we're going to, have a great success.
Yeah, absolutely. And a really great thing about having PT, in your home,
Mm-hmm.
is that you're able to see tasks that they do throughout the day. And then,
Yeah.
if it's possible, what I like to do is kind of stack those tasks. So I'll turn, like washing dishes at the sink.
Yeah,
Great, let's turn
I
this into
love
an
it.
exercise. Yeah,
Yes.
or,
Yes.
every time you pick up your baby, let's
Mm-hmm.
practice this strategy. So, really
Yes.
incorporating these great
Yes.
strategies and exercises into their daily life, because
Mm-hmm.
we know moms don't have time,
Yes.
and
Exactly.
yeah, and we don't want to take up any of their time as well, but we know that in order for them to pour into the lives of their children and their families,
Mm-hmm.
they need to have their cup full as well, which means we got to
Mm-hmm.
make sure that our ladies are at the top of their game, that they're not
Yes.
dealing with any lingering dysfunction. So we want to work that into their day as much as possible and make it as easy as can be and as fun
Yes.
as can be. Yeah,
That
I've
you
even
you
had
yeah.
sessions where we use the children as weights and we
Yes.
have them go
Yes.
through a
Yes.
whole circuit. Yeah.
Yes, that's a great, great, great idea. And one thing I forgot to mention, when you asked me about tools, I forgot all about that. With regards to the vaginal work, some of my patients, we will incorporate the use of tools that they will learn how to use. So it empowers them too to get involved with that releasing process. So something like a TheraWand, or the wands by Intimate Rose, they are used to kind of mimic the work that we do in the clinic to release the tightness. And so for those that are comfortable with that, I'll show them how to do use that tool, and they'll be able to use that throughout the times that we're not together as well.
Awesome. Great
Hmm.
info. So, Taya, what advice would you give to any of our mamas who may be listening or watching this interview and they're thinking to themselves, oh my gosh, like I resonate with everything Taya said. I think I have
Yeah.
stress urinary incontinence. What should I do?
The advice, like I said before earlier, is the first thing I would do is either you've spoken to your OB or gynecologist, or you may have already been discharged and not really seeing them, and you may notice, hey, I'm leaking when I cough, laugh, sneeze, lift, or anything. First thing I would say is seek out a pelvic floor physical therapist in your area, and that may be sometimes a little challenging. So there are some resources that you can use, like directories that you can use to seek out a pelvic floor therapist, or even just a simple Google search. Seek out a pelvic therapist and get that assessment. That pelvic floor therapist will be able to really do the full examination of your abdomen, of your hips, of your pelvic floor, and your back, and any associated areas, to see what the cause is. What the cause is that is contributing to your stress incontinence, and then from there create a plan for you specifically. I do caution patients and new moms in particular, because I know some of them want to get back their bodies the way that they were before, which is great. But sometimes they jump into programs that they find online really early, or just without a lot of guidance. And because that person on the web isn't your physical therapist, or isn't in your home to correct you on certain things, then you could be putting yourself in a little bit more of a pickle. So I often would tell them to, talk to their physical therapist about the programs that they're doing, so that their physical therapist can then direct you properly in what you can, do outright, or what you should modify. Because like I said, if you go in and start doing a lot of Kegels, for instance, or a whole bunch of core work that's a little advanced, you may find that some of the symptoms may worsen. So we want to avoid that as much as we can.
Absolutely. I agree. I'm so glad you brought that up. And
Yeah.
so many pelvic health PTs do offer initial consultations over the
Yes.
phone or over Zoom, um,
Yes.
in a HIPAA compliant way. So
Yes.
So if anyone is interested in, talking to a public health PT, I think even if you just want to know what the process is about, you can
Mm-hmm.
definitely reach out to pelvic health PT, set up an initial consultation. Some of them call
Mm-hmm.
it discovery visits, and really
Yes.
just talk to them, let your story be heard. And if they're able to help you or give you advice, then you can talk about
Mm-hmm.
moving forward and maybe
Yes.
partnering together to work towards your goals.
Exactly. And I'm glad you mentioned that because with my company, I do offer that 15 half an hour phone consultation just so we can talk things out and you can decide whether or not PT is for you. And basically just hearing your story as far as what your symptoms are and what's going on, and then kind of giving you a little bit of direction on what's the next step. So I love to talk to people ahead of time so we can make sure that this is even the path that you need to take. So that's definitely something we offer.
Yeah, absolutely. I
Mhm.
thought you did. That's why I was bringing it up. Perfect. Good, good. And you also do telehealth as well,
Oh,
Tyra,
yeah.
right?
Yep,
Oh, good.
you hit the nail on the head. I was just about to say, and we also do telehealth, and basically, and I will get the subjective and do everything that we would do if I'm with the client in person, but just the hands-off portions are excluded. But basically, from what I hear them talk about and see them perform over the screen, we'll be able to again devise a plan and be able to slowly but surely chip away at some of those issues that they're experiencing. And I've had great success with some patients not even needing for me to come in by way, just doing the sessions by way of virtual and getting great outcomes as well.
That's amazing. Love it. So
Mhm.
lots of ways to get in contact with you, whether it's
Yes.
for, consult, a discovery visit, those 15 to 30 minutes that you're talking about, just to
Mhm.
hear an individual's story and hear their struggles and give them guidance. And then you
Mhm.
also offer telehealth services, you offer mobile in-home services. I mean, you're
Mhm.
just so accessible. It's
Yes.
great. It
Yes, I
really
try
is
to
that
be.
quality. Yeah, love it. So, Taya, for our listeners and those who are viewing this interview, interested in working with you or with you, and being able to tell you their story and get advice and guidance from you, and perhaps work with you, one on one to reach their goals. How would our mamas be able to contact you? Where can they find you?
Okay, I'm glad you asked. So basically, one of the best resources will be our website, which is www.qualitytouchpt.com. Then we're also on social media, Instagram and Facebook, and it's at Quality Touch PT. And then also, I'm in the beginnings of creating a YouTube page, which would be the name of the company, Quality Touch Physical Therapy and Wellness. So they can definitely get in contact with us on any of those mediums. They can direct message. They can also call us, of course, at 301 246 2353.
Perfect. And I will drop all that contact information and the phone number in
Mm-hmm.
the notes following this interview. And I
Mm-hmm.
had no idea that you're doing a YouTube channel. You're just full of
Yeah,
surprises.
I'm coming out of my comfort zone here.
I love it. Oh my gosh, I'm so excited for you. Every time we
Yeah.
talk, Ty, you're up to something new, and I love
Yes,
that.
yes, indeed.
That's amazing.
Thank
Wonderful.
you.
So, anything else that you would like to share with our mamas, or any
Um, you know,
closing words?
Yeah, definitely. Just know that you're not alone. I know it's like, especially for the new moms who may not have had this happen to them before or may not know what to expect. You're not alone. There's definitely a lot of support out there. There's obviously a lot of people that are going through what you're going through, and there are definitely some options out there for you. So don't think that you have to just live with this. I know that some people have probably told them that, oh, that just happens after you have a baby, or that just happens as you get older, or anything along those lines. But we want to let you know that there is help. There is help for you, and we're here to, just help you on your journey.
Amen. Love it.
Mm-hmm.
So good. Such amazing words of hope and healing and just
Mm-hmm.
inspiration for all of our mamas out there. Taya, thank you so much for your time and spending it with me in this interview in our community. We really appreciate it. We just love having you on. Big fan of yours. Love everything
Thank
you're
you.
doing. And I would just encourage all of our listeners and viewers, if you would like to get in touch with Taya, if anything that she said really resonated with you, please reach out to her. She is a wonderful, amazing clinician to work with. And if you're looking for a pelvic health PT to have in your corner and have on your team, what a blessing it would be to have Taya with you. So please
Thank
reach
you.
out to her. Yeah, well,
Yep.
thank you again for joining us, Taya. Appreciate it so much. Um, I mean, we just saw each other like an hour before
I
this in
know,
a
I
training.
know.
So I feel like we just keep popping into each other's lives. I'm sure I'll see you at a webinar soon.
Yes, of course. You know, the community is small, so I
Mhm.
definitely expect to see you again soon.
Awesome. Wonderful. Well, thank you again. We really appreciate it.
Thanks.